Infant is lying in the incubator.
Come on guys, let's check the vitals and BP.
Oxygen saturation काफी low है. Let's increase the oxygen flow.
BP 65.
Temperature is 97.7 degree Fahrenheit. Just keep an eye.
Heart rate is 180. Let's get an ECG.
Let's also get an arterial blood gas analysis done ताकि acid base balance का भी पता चल जाए.
Scene 2, junior doctors started discussing. They are gathered around the computer and they are now checking the patient.
I have never seen a premature baby with symptoms like this. What do you guys suggest?
No, I've seen a similar case where the infant had surfactant deficiency. We should consider that as a possible cause.
I think we should consider sepsis or pneumonia.
But what about respiratory distress syndrome? It's not just a simple infection.
I agree with Faiza. I think we should consider other options as well.
Has anyone seen the X-ray? What's the parents like?
No, we are still waiting for the results. Let's see.
Scene 3, still in the NICU. The nurses enters into the NICU and hand over the lab reports and the X-ray to the junior doctors.
Okay, let's see. Look, oxygen saturation is still low, even with the increased oxygen flow.
The X-ray shows ground glass surface. I think that's not good.
That gas test shows respiratory acidosis. We need to correct that as soon as possible.
It shows tachycardia. We need to find for any arrhythmias.
The surfactant levels are also low. I think it's RDS.
But what about APGAR scores? Only 5 at 1 minute and 6 at 5 minutes.
That's a red flag. We should consider the worst case scenario.
Shall we consider incubation or ventilation?
Not yet. Let's try to stabilize the baby first. I agree with Faiza. Let's wait for Dr. Shahjahan to come.
The junior doctors nod in agreement. Scene 4, NICU. The consultant enters.
Show me the lab reports.
So, tell me about the patient.
Sarah, 28-year-old female, 28 weeks pregnant, came to ER with contractions and went to labor shortly after.
Okay.
Gave birth 24 hours ago to a premature baby which exhibited fast and shallow breathing, cyanosis, and crackles during hospitalization.
The baby was rushed into NICU and immediately given oxygen. The baby is stable as of now.
Okay, and what were the differentials?
After examination, the symptoms include tachypnea, cyanosis, and pneumothorax. Low surfactant levels and respiratory acidosis were detected. And the X-ray shows ground glass surface.
And
The mother had gestational diabetes and hypertension during pregnancy. The delivery was via C-section due to fetal distress.
The lab report indicate a high level of respiratory of reactive oxygen species, and APGAR scores show 5 at 1 minute and 6 at 5 minutes, which indicates the ongoing respiratory difficulties.
why is ROS levels increase and APGAR scores are low?
And how does it impact respiratory functions?
Hypoxia causes increased ROS production and hence causes oxidative stress and inflammation. That's why AVGAR scores are low.
And high levels of ROS can damage the lungs and airways, causing it harder to breathe and making the condition worse.
Okay, that's a good start. Any other specific findings in the X-ray?
The ground glass appearance indicate diffuse alveolar disease, and the air bronchogram suggests alveolar collapse.
Oh, that's nice. What do you guys think? What type of cyanosis is this patient exhibiting? What? This is central cyanosis, in which there is decreased level of oxygen in blood. Okay. Anyways, did the mother receive any steroids before the baby was born?
Sorry, we forgot to ask.
What do you mean? You guys should have asked this. Are you doctors or not? Okay. Was any prenatal testing done to check the lung maturity or something?
Yes, doctor. A prenatal lecithin to sphingomyelin ratio test was done. It showed that the lungs were immature.
Oh, okay. What do you think final diagnosis can be?
The respiratory difficulty and chest X-ray are consistent with RDS.
Excellent. Okay, so now walk me through the pathophysiology of RDS. What do you guys think? What's happening at the alveolar level?
In RDS, the level of surfactant increases surface tension, causing alveoli to collapse, decreasing lung compliance. This increases the work of breathing and results in respiratory failure.
Okay, how does the lack of surfactant affect the alveolar capillary membrane?
The increased surface tension disrupts the alveolar capillary membrane, which causes inflammation and oxidative stress.
What are the main components of phospholipids?
The surfactant is composed of phospholipids, which include phosphatidylglycerol and phosphatidylcholine, which is important to reduce the surface tension.
Okay. Was there any visible retractions of the chest?
Yes, there were visible retractions of the lung, especially intercostal and subcostal.
So, how would you manage this patient?
We will go for surfactant replacement therapy to reduce the surface tension, ventilatory support to reduce the work of breathing, and oxygen therapy to maintain adequate oxygen supply.
Okay, that's nice. What are the complications of RDS?
Short-term complications include respiratory failure, cardiovascular instability, and infections. The long-term complications include bronchopulmonary dysplasia, chronic lung disease, and I think
let's go tell the parents that their child is stable for now. And you guys, I want you to keep monitoring the patient, and I want frequent blood gas measurements and also the chest X-ray. Okay? So I'll be right back.
The consultant and junior doctors enter the room and they greet the concerned looking parents.
Assalamu alaikum.
वालेकुम अस्सलाम। डॉक्टर साहब, क्या मैं अपने बच्चे को देख सकती हूँ? क्या मेरा बच्चा ठीक हो जाएगा?
हमने आपके बेटे को ऑक्सीजन पर लगाया हुआ है ताकि उसकी सांस जो है वो बाहर रहे, ठीक है?
हमारा बच्चा ठीक तो हो जाएगा ना?
असल में आपका बच्चा 7वें महीने में पैदा हुआ है, जिसकी वजह से उसकी लंग्स जो है फेफड़े वो सही तरह से नहीं बने, ठीक है। इसको एक बीमारी हुई है जिसको हम रेस्पिरेटरी डिस्ट्रेस सिंड्रोम कहते हैं।
क्या मैं अपने बच्चे को देख सकता हूँ?
आपके बच्चे के अभी फेफड़े मुकम्मल तौर पे बने नहीं हैं, जिसकी वजह से वो अभी सही तरीके से सांस नहीं ले सकता, जिसके इलाज के लिए आपको हर हफ्ते लाजमी अस्पताल आना होगा।
बच्चा ठीक तो हो जाएगा।
हम इसका इलाज कर रहे हैं, ठीक है। एक थेरेपी देंगे हम बच्चे को, जिसको हम सर्फेक्टेंट रिप्लेसमेंट थेरेपी कहते हैं, और इंशाल्लाह आपका बच्चा उसके बाद बिल्कुल सलामत हो जाएगा, आप फिक्र ना करें।
चलिए, शुक्रिया, बहुत शुक्रिया डॉक्टर साहब।
So here is the conclusion of the whole working and the conclusion is that the complex to this whole thing. Thank you.